screen. So I would like to have a feedback from the technical support of the meeting. So thank you very much also from my side to be part of this very interesting medical forum of this conference of the Hellenic Medical Diaspora. And dear Savas, congratulations, because the program is all your organization, your ideas, and I'm very glad to be part of this program. Yes, Vascular Surgery-Quo vadis is the title of my talk. As you said very nicely, I'm the director of the Department of Vascular Surgery, very close to Frankfurt, very close to Darmstadt, but we are responsible for an area of more than 500,000 people in the Offenbach area. So we are more than glad to serve and offer vascular services. So let's start with the presidential address from Professor Frank With, well-known vascular surgeon, professor of vascular surgery in New York. In 1996, he was the president of the Society for Vascular Surgery and published a presidential address about the combination, about the idea of Darwin and vascular surgery. So the idea is that, as Darwin believed, the death of species, especially specialities, is a consequence of non-adaptation to changing circumstances. And I think this is very crucial because Professor With highlighted this impact in 1996 and highlighted that vascular surgeons must acquire endovascular skills, which is very crucial because, as he reported, this is crucial not because in some fields the endovascular treatment is the number one successful option for our patient, but we can improve the surgical outcomes, such as in case of a typical thrombectomy with fluoroscopically assisted angiography, or we can perform a completion angiography after carotid or bypass surgery, and then we can check and evaluate our anastomosis. So this is very crucial to adapt, to acquire endovascular skills, and this is something which highlighted in 1996. If we consider the PAD lesions, we have a mosaic of different types of lesions. So we can have severe calcifications, we can have a combination of calcification and thrombosis. So as you see here, there is a mosaic of lesions, and this means that the treatment can be more complex as we can imagine. And of course, as vascular surgeons, we believe on vascular bypass surgery. We can perform with veins very nice deep anastomosis in the distal posterior artery, as we see here, and we can salve the limb with a nice vein bypass. Or in case of acute occlusions, we can perform an embolectomy, PTK, below the knee with embolectomy with Fogarty catheters. We can use low-profile Fogarty catheters. We can remove the thrombus, and we can perform a patch angioplasty with a very nice result with palpable pulses. So there is no doubt that we have a plethora of options, rural surgical options. But if your only tool is a hammer, everything starts to look like a nail, as Mark Twain reported. And I think it's very crucial as vascular surgeons to implement endovascular techniques in our armamentarium. And we have a plethora of good options and good indications to start treating the patient with less invasive techniques like endovascular techniques in obese patients, as you see here, in patients with huge ulcera without a good option to perform a bypass, or infection of the foot. So this is a crucial point that the vascular surgeons should implement endovascular techniques, and we have a plethora of options. We can use different catheters, minimizing the need for stent placement as atherectomy catheters. As you know, Savas, PTA is out. We are doing something more like atherectomy. We have catheters with front-end cutting tip that rotates. We have the possibility by this to also aspirate of particulate debris and thrombus. And then we can treat calcified lesions, as we see here, with these kind of types of catheters. With additional balloon angioplasty, we have a nice result in these calcified lesions without the need for stenting. Or, for example, female patients with small-sized vessel, heavy smokers, we don't want per se to deploy for these kind of patients stents, because you will have probably an occlusion over time, And this is a good indication to perform atherectomy to modify the plaque, and after additional balloon angioplasty, you can avoid the placement of additional stents. Or in case of mixed lesions, when you have thrombus and calcification, you can use the different types of catheter. You can aspirate the thrombus, and then you can treat the case, as you see here, very nicely with a very nice flow in the foot. We have also the possibility to improve our diagnostic armamentarium with the use of ultravascular ultrasound, IVUS. We have done it in Lange for first time in Europe with modern new catheters. So you see exactly how is the lumen of the vessel. You can evaluate the calcification, the stenosis, the type of stenosis, and you can perform your catheters, and then you see how is the impact in your vessel. You see the different now lumen after the performance of atherectomy and after balloon angioplasty. You create a new lumen very nicely without the need for stent placement, as you see here, and you can confirm this by these modern IVUS tools. The next day, we check the patient with typical triplex, as we see here, with a very nice triphasic signal in the popliteal artery. About aneurysms, we had a presentation from Dr. Oikonomou about the options which we have. Mainly, we have two options, open or endo repair, but also in this field, it's very important, the vascular surgeon, to offer all options which we have. And this is crucial. There is a standard treatment, the open approach, here an example of a bifurcated graft. But also for high-risk patients, we can use flexible, low-profile devices, and you can treat the patient with small incisions of the groin, either with a standard endograft or with a more complex advanced EVAR as fenestrated endografting or chimney endografting. Here is a nice case last month of a patient who came with PAD and stents, as you see in the groins. So when we evaluated the case, we realized that the problem is not only the PAD, but also a huge juxtarenal aortic aneurysm, and therefore we had only the open option. We removed the occluded stents, as you see here, without any impact in the flow, also covering the profound femoral artery and performing an open bifurcated graft with very nice result, as you see here in the merangiography, with patent of the profound femoral artery of the SFA and exclusion of your aneurysm. Very important is the logistics, the infrastructure. We have modern ORs up to now. We have the possibility of the hybrid rooms. So we combine quality in the imaging, less radiation, and also the benefit of time consuming for our patients, as you see here. Of course, education is very important in vascular surgery nowadays. We try to demonstrate all these techniques to interesting vascular surgeons, as you see here with my old good friend Francisco Acevedo. When we were in Münster together, we had the possibility to do different hands-on models to demonstrate all these complex techniques. And we had a very good feedback also at different meetings, but also the possibility of simulation of vascular disease and treatment. We started very early this for the students of the university lessons, 2018 with Professor Tosello in the University of Münster. So there is no doubt that the modern vascular surgeon has a significant value to the healthcare system. This is the big benefit to combine open and endovascular therapy into hybrid procedures. This is a big advantage which offers the modern vascular surgeon. Also in different fields, like in the venous disease, we have also here the possibility of surgical and also minimal invasive endovascular techniques. And Dr. Apostolidis is one of the pioneers in this field in the venous disease. But also in the carotid artery disease, you know how important is the treatment of carotid atherosclerotic disease, responsible for more than 40,000 strokes annually in the United States. Also here are the vascular surgeons, the experts in the medical, but also procedural treatment of carotid artery disease. Last but not least, very important is that the vascular surgeons offer valuable services in the hospital to surgeons of other disciplines when complex operations involve major vascular structures. So this has an impact not only on the case mix index of the vascular surgeons, but also of the hospital-wide case mix index. So in a summary form, dear colleagues, vascular surgery has a protagonistic role in the treatment of cardiovascular disease, especially when the endovascular skills are implemented in our surgical armamentarium, and this is very important and beneficial for our patients. This is the standard therapy of our hospital also, and I'm very glad that I had the opportunity to present our approach at these meetings. Thank you very much for your attention. Warm regards from Kalamata, Messina.